not fired up, dude. Hey, guys, we're live. I'm initializing my 360. Then we'll be able to start the show.
And now something completely different.
Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Cobrin's The Bald Truth.
Hey guys, welcome to the show, 888-659-3727. You guys had a little behind-the-scenes glimpse of things not being completely prepared. What are you going to do? Hey, Joe.
What are you going to do? Hey, man. How's it going?
I almost asphyxiated myself today. I just, normally I try to spray my hair outside. But I rushed and I did in the bath, and I'm coughing now. I'm like, geez, this shit is going to kill me.
I was wondering if that was just a few minutes after you joined the David Carradine fan club. What?
Yeah, I kung fu reference. I got it. Stopped smoking many, many years ago. But it's very possible this hairspray situation is going to make me ill. I don't know, but I definitely feel it more in my lungs when I breathe it in. So there you go. Guys, give us a call. Phone number 888-659-3727. We are live from Los Angeles. Just did the UK show, which was stellar. And now we're doing our main broadcast, which has been on the air for 23 years. And doing it with Joe Tillman for it's got to be a decade. How long has it been? 7 years?
On where I officially came on board as co-host, it's been 6 years as of last month.
But who's counting?
I think, or this month, or who's counting? And then before that, I was actually calling in since I think 2005 or 2006.
I think there's some videos online when GFQ is putting the show up. And by the way,
yep.
Something else and it just spurred this thought. Someone contacted me through Instagram. Was like, when are you going to start the podcasts again? And then somebody else asked me on the same day, where are all of your archives? And you know what? It was a long time when I was just kind of we have them on, obviously, on Joe's YouTube page. But for a long time, I was considering just leaving. So I would do the show, and I wasn't putting out podcasts or anything. We'd do the live show. If people had the opportunity to watch it live, that was it. GFQ is putting it up online, and that was it. But that's going to change. So besides having everything on Joe's personal YouTube channel, which is youtube.com/hair transplant mentor, we are going to be putting up the audio podcasts starting this week on iTunes and Spotify, and it's going to be done on a regular basis because I think I've told you guys I've kind of made the decision to stick it out and come back on a regular basis. Not just do the show, not just do the live show, but actually get the content out there in a much bigger way. And the main reason is, as I say all the time, it's become so dangerous out there that, look, I'm doing the live show anyway. We might as well put a little bit more effort into it and get it out there for more people to hear it on demand. You busy, Joe?
Yeah, sorry. Don't interrupt me.
Okay. Guys, the phone number is 888-659-3727. If you don't know what we're doing, this is the hair loss show, The Bald Truth. And I always say that. Now I say this is the hair loss show. There's a hair loss show now, so I don't want to confuse it. And that's a good show. These doctors are doing a really good job. But I've been calling The Bald Truth the hair loss show for 23 years. So when I say it, I don't want to step on any toes.
But this is the OG hair loss show.
Yeah,
it's like,
it is.
You're not stepping. They're stepping on our toes. Like, time to recognize.
No, they do. What's nice about them is that they do recognize, and they've been very complimentary, and they put out a lot of good content. It's great that it's two physicians. I like the way that it's done, and I think they offer a really good service. And I cannot say that for most of the people who are putting out hair loss content online.
I have to say, full disclosure, I have not seen their show, but I've heard good things about it. So,
you know who also provides a good service? That Bald Cafe did. I was sent something. I was sent something from a SMP segment from his show, and what's his name? Harry.
Yeah,
Harry. I apologize. I don't really watch it on a regular basis, but every once in a while, I mean, I know about it, and I've seen some stuff. He's crushing it, but I got to tell you, man, if you guys could handle your hair loss and you're equipped to deal with hair, I'm gonna pimp him out a little bit on this program. That is a great, empowering place, I think.
Yeah,
I think he provides a really good service for people that for those who are equipped to deal with shaving their head. That's your first line of attack. For all the rest of you, which is like 90% of you out there. Obviously, that's what we're here for. Come to us. We'll give you the best information we possibly can and tell you the truth about this insane industry before you get cut, before you destroy your lives, before you waste all your money on bogus products and services. Mm-hmm. But if you're considering shaving your head, that's a good show.
Well, when he first started, I remember it kind of tapped into what I've always told guys as an option. Try this, try this, try this. Have you tried shaving your head? Like, what's the worst it can happen? It grows back, that kind of thing. And he really tapped into that. I don't even know how to describe it. That alternative option, where I've always talked about it just because it is completely acceptable in today's world. I couldn't do it back in the early 90s after I had my first, or even before I did my first 2 hair transplants, because if you're a white guy and you're shaving your head back then, you were a skinhead. You were a neo-Nazi. Now it's like, well, I mean, throw a rock. You'll hit someone eventually that shaves their head. I'm like, it's completely normal. So I couldn't do it back then. But now, because it is such a normal thing, guys with hair loss are more afraid to do it than guys without hair loss. And so he's really opened that up. Like, he's tapped into it. And I think, like, I really am happy to see how he's crushing it. And I was on his show, like we did an interview, and he seems like a genuine guy. And he's just trying to, he's got a couple of products. He's got like shaving products and a couple of things like that, which, I mean, it's awesome. Like, that fits. It's usable products where there aren't any claims that are being made that I'm aware of that are unreasonable, and good for him.
Look,
I'm glad he's doing it.
I mean, again, I haven't watched it. A lot of it. So, I mean, I'm just looking at the chat room, and there's something about, just shave it, bro, finasteride is poison. The reality is, I don't know if that's any part of the messaging, but I do believe that before anyone ingests any medication, before they do anything, that should be the first consideration. Can you deal with this? Or if medication doesn't work before you have surgery, can I deal with this? Now, for me, I couldn't deal with it. There's no fucking way. Especially when I was young. And now, even now, I resign myself to either getting, painting my head more, getting a hair transplant, or gluing some hair on, as the yarmulke grows, if it does. And that's it. And it's actually liberating to just be able to say that. Because just by saying that, people are like, okay, well, that's what he does, whatever. That's how he lives his life. So part of the reason, a main aspect of this program is just to let people discuss a subject that society doesn't allow us to discuss without being judged for feeling the way that we feel about it. Going in and just shaving your head and just shave it, bro, that's a great way to move on, if you can. But the reality is most of us are not equipped to do that, and most of us, it's a process. And we're not allowed to mourn our hair as men. We're not allowed to deal with the process of losing our hair in a healthy way. It's either one or the other, right. Black or white. That's what this program is about. So give us a call, 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
This is John from Illinois.
Hey, John. Welcome.
Hello, John.
Hey, thanks for taking my call. Long-time listener, first-time caller. I just want to say I think you guys are saving people's lives. I really do, and I think that
well, thank you.
I think you guys are great representatives of your brand. Joe, you with Trials and Tribulations, with multiple transplants, and then Spencer, you with what early prevention can look like. So, but in addition to that, I think your guys' hair is great.
Well, I appreciate that. It goes from, it's funny when I look at comments on both Joe and I's, stuff. People are very complimentary and people are just very awful as well. It's fascinating to get people, everyone's perspective about that. But I think what I appreciate more though is kind of your breakdown of what we do. That's why I brought Joe on after years of doing the show the way that I did it, is because I don't have that perspective. I have not been butchered and then repaired and gone through 10 surgeries, or have worked in the trenches in a clinic day in, day out. My perspective is much different. And I think Joe learned from me when he kind of got more associated with the show of what it's like to deal with all the different clinics' perspective and all the patients that come from these different places from all over the world, because it's a lot different than his initial perspective of what's going on.
I thought the problems I was seeing was just unique to my own experience. It's not.
No, it's bad. It's bad. Anyway, sorry for the ramble. Thanks for calling. What can we do for you?
Yeah, no problem. I guess the question I had, among others, was body hair transplant. Is it? Of course, I think we all know that head hair is best hair, but you think body hair transplants are that bad? I mean, what about like a blended approach where you take 1,000 grafts from the back of the head, maybe 200 from the beard and 300 from the body, and you kind of have this blend approach, and then you kind of are saving future grafts.
Joe, I'm going to let you take
I think
this.
I mean, it's I can't say it's a common approach, but in some of the more experienced clinics that have been around for quite some time, it's not uncommon for them to take this approach. But even the best clinics out there will tell you that body hair is secondary, no matter how good the body hair is, as far as the texture and the numbers that you may have available for transplantation. It doesn't replace the quality and the survivability that you'll get with scalp hair when assuming the procedure is done properly. So when you look at the level of types of hairs as far as like their survival chances when it comes to transplantation, scalp hair is king, which you're already aware of that. And then behind that is beard hair. Beard hair tends to have the highest survival rates of all non-scalp hair. And then behind that would be chest hair, and then it drops off significantly after chest hair, like back hair or leg hair or what have you. So it comes down to what are you willing to spend, not just in money, but in donor hair. And not just scalp hair, but like if you want to take that route, how much body hair are you willing to go through before you actually get enough moved that also survives to where it makes Oh, I'm out of focus. Hold on a second. What's going on?
What's going on?
There we go. I don't know. There we go. Now I'm back. It's going crazy on me. Yeah, so it's like how much body hair are you willing to give up to where you cross that threshold where it makes a difference? 200 grafts, 400 grafts, 600 grafts, where maybe 70% grew. So that 500 grafts is now, quick math, 350 grafts, maybe. So is that what you want to go through? Whereas if you went strictly scalp hair till it was no longer an option, then you have potentially a higher survival rate, a better experience cosmetically, only because the hair is going to match better, and then you can resort to beard hair and say chest hair. The problem with with beard hair is that the texture doesn't really change over time, as far as I'm aware of. I don't know of anyone that's claiming otherwise, but the texture of your beard hair will always be the texture of your beard hair, even on the scalp. Body hair, such as chest and back, once it's transplanted, there's mixed information out there about the long-term effects. Does the scalp influence body hair to where it will blend in and look more like scalp hair? There's some evidence it does, but I think that
Ray Woods,
you can't rely on that.
Ray Woods, who is now unfortunately just a footnote in the history of hair transplant surgery and FUE, and he was the OG guy with the Woods technique. I think it's just ridiculous and it's sad, and it's just, and I understand some of the reasoning why, but the truth is, anyone who's writing the history in these textbooks, to leave him out in the way in which they do is not only, in my view, dishonest. It does the entire industry a disservice. But with that said, he did show back in like 1999 or 1998 that at least for one patient that he implanted body hair on, that in time, body hair that only grew just a few centimeters eventually did grow and took on much longer life cycles and was growing almost as long as his native hair. And that was pretty stunning.
It was. And then in my own case, where I had, it was less than 100 grafts transplanted, but it was from my chest into my crown. Dr. Wong had done, I forgot how many, I think we counted that 80 grafts replaced, 27 grew, so it was just over a 30% survival rate. This is the second time he'd done body hair, and that was 15 years ago, so it's not, to be applied to anything he may be doing today. But it's still growing. It blends in perfectly with my scalp hair, and you'd never know if you were to even look under microscopic examination. So, but I also have the benefit.
When you came to my place, I was
similar to my
when you
scalp
came to
hair.
my place, the first thing I was like, is that chest hair on his scalp? What's going on here?
Is that chest hair sticking out of his crown? What the hell?
Yeah.
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 I don't like the idea. I don't think it's necessarily. Well, I don't know. I mean, I think Joe's initial response is the way to go. I don't necessarily think that. Well, let me ask you this question: how much chest hair and how much back hair, how much body hair do you have to work with? First of all,
me?
Yeah.
A decent amount, actually. When I look at my chest area, when I look down on my chest, I'm thinking, man, I wish this was on top of my head. It's like a 2-inch, 2.5-inch, 3-inch long hair. It's kind of the same texture, kind of a coarse texture.
Mm-hmm.
And then when I look closely, I can see triples, quadruples, doubles, and it's like, man, this is a prime spot to take from.
Well, again, the good news is that if that is needed at some point, it's there. But I don't personally think it should ever be used for primary, hair transplants or even as a second hair transplant if you have the right amount of donor hair to be moved. Now, I didn't listen to everything that Joe was saying. I'm pretty sure that probably was Joe's comment.
The last comment I wanted to make or question was, you know what, it's interesting. It took me a long time to kind of compartmentalize the message that you guys have. You know, I mean, you know, when you're young and you kind of see these commercials about transplants, it's almost like a quick fix. And it really took years listening to the show to kind of come back and say, hey, medication is the first line of defense. And you know, I think you guys have a tough job in front of you, especially when you watch these commercials, and even like you guys have talked about where doctors kind of describe this surgery as a procedure, or it's not really surgery. It's just it was only recently that I came to the realization that yes, medication was the first step.
Well, I was under the impression when I started. Sorry to cut you off. That when I started that, once I pulled back the curtain on this industry, that everyone who found us and found me, especially when I was on the radio and when I was first, you know, when the book first took off, I'm like, it's going to change everything. I mean, people, once they see it, they're not going to be stupid enough or vulnerable enough to fall for this shit that they see out there being marketed and advertised. And boy, oh boy, was I wrong. And, you know, when I started this, I didn't think that I would be doing this for 23 years. I really thought it would be a limited part of my career path, that, you know, I have another thing that I do. And I was like, this is just going to be, you know, okay, I've sold this book. Fantastic. I started these organizations. Great. This is going to help a lot of people. But I didn't think that I'd be doing this for 23 years. And what you just said is why. Because it takes people, usually, sadly, they will find us, find me. They'll always find the American Hair Loss Association through some article. They'll read the information on there and they'll be like, wait a second, there's nothing here that's going to fix me. This is just giving me information, education, what I need to do, what I need to avoid, but I need to be fixed. And that's where people tend to go first. And then they come back after they've been fucked up, or they made the wrong move, or they've been ripped off 100 times, and then they're like, okay, these guys are still here.
Yes. I always I show people a lot of times I show people, Joel, your video with the Try Guy, and you know, it was a really good breakdown of the process that the Try Guy went through, and a lot of the problems in the surgery, even like simple things like the doctor wearing a mask, or the technician when he was extracting hairs, where he took it from one spot rather than moving the head around. I mean, it was, even when they first drew the hairline, they kind of made it very low, and then the day of the operation, they raised it up. And that, you know, what's amazing about that is they broadcasted that on YouTube, but that was their best work. They were showcasing this as their best work, but there were so many glaring problems with the procedure.
Well, you know, listen, you know, I would say what Joe does and the way in which he does it can be incredibly empowering for people who are willing to listen. However, I have seen, and in my career too, I still get hate, but I've seen Joe get a lot of hate just for, again, revealing the reality of what's happening out there, what's happening in this field. I think, look, all we can do is do our best. And you came around, you found us, you're one of, you know, whatever, 10% of the hair loss sufferers out there doing their research that really takes the time to listen and does things, and, you know, recognizes that all we're doing here is we're out here to give you guys the truth. And that doesn't resonate with a lot of people. People always think, well, what's the ulterior motive to the truth? Or there's a reason, or, you know, these guys are Merc shills, or this or that, the other thing. You know, we're just here to tell you the truth. And you take that information and do what you want with it.
Yeah. One last question about hair transplants. I'm not sure if any doctors ever made this strategy, but of course, one of the biggest fears is having, you know, scarring, like a large scar. Is there anybody that does it where they kind of, let's say they take a vertical strip, like a 3-inch one, or you take a 3-inch strip and then you come back and then you just take from that same 3-inch strip. You end up, instead of having one big operation, you might have 5 or 10, but you're always on that 3-inch area, you know. And so then, let's say in the future, 30 years from now, you know, you lose a lot more hair and you want to go bald, or you just have this 3-inch scar versus a 24-inch scar, 24-centimeter scar rather.
It's kind of an old school way of looking at it as well. Just to let you know, there were times when physicians would make multiple kind of they call it like a ladder, step ladder scars, take out small pieces of tissue from one side and then from another side.
I had that done. Yeah, not vertically, but
it never ends. It never ends well. And I have known, just to interrupt you, sorry, I knew a guy who did a vertical incision. Told me about it, and when he showed me the results, I'm just like, why would you do that?
Why?
You know?
Well, yeah.
How can you do that to somebody?
Idea, and who would agree to it? Yeah.
Well, the person that came up with the idea actually is a guy that has a lot of shit written about him, you know, in textbooks, and it's amazing to me. Go ahead.
Oh, that guy. Yeah.
What was the issue with the vertical strip?
Well, I want you to think about how every strip essentially changes the integrity of your scalp. And as you move that scalp around in different directions, you're going to have a kind of a different overall integrity to the back, to the sides, to the temporal points, to the top of your hair. So if you're pulling something in vertically, then you're causing a change in your entire structure in that direction. If you're pulling something down and you're able to take more grafts out, the worst case scenario, especially after one strip, is maybe you'll have a little bit of a rise in the integrity of the back of your scalp. Usually that's probably the worst as far as unless you get stretch back. But I haven't seen any overall change in integrity. When I saw this vertical cut, you could actually see it as the hair grew out. You can see that the hair just didn't match up from side to side. Yeah. It's a lot easier to cover if there's that kind of like integrity change. It's a lot easier to cover that, you know. Like, have you ever seen guys who had multiple transplants and then even though their hair is grown over it, you can't see the scar, you can kind of see that the hair is growing in two different directions or slightly not overlapping directly.
Like I have it on my own case. I have to turn the microphone a little bit. If you, hang on, there we go. So if you look above my ear, right?
Oh, I see it. I never noticed that.
Yeah. So this line right here, it shows a stark change in direction. So this hair here is going back like this, and this hair up here is going down, right? And so when my hair is longer, you can't see it. But I've been keeping my hair short for the past several years, and that's where, like, I see it, I'm like, damn it, my scar is visible. It's like, oh, that's not the scar. It's just the hair direction change, which happens to be a line.
Yeah.
And it's really
actually
bizarre.
very common. If you had multiple surgeries.
Well,
but the vertical one is really weird
had multiple
to look
surgeries.
At.
Yeah. And the vertical I can imagine would be even more disturbing. But just a little bit of spray I can kind of redirect it a little bit. But naturally, it's a hard 90-degree angle all the way around, and not in the back, but on both sides. Like can you see on this side too?
Not really. I mean, you can see a little bit, but not really. You have to really look for it.
Yeah.
But that's the thing. You know, that's another aspect of this procedure that people don't talk about. There are. Listen, I still think that strip is a procedure that any really great hair transplant surgeon or clinic should be able to offer and know how to perform well to state-of-the-art standards. But no matter what the surgery is, there's always going to be limitations and issues that people don't ever even talk about. You hardly ever hear about this online, but that direction of growth is a real issue. And a lot of people who have had multiple strips will have it, and to me, it's one of the biggest giveaways of a hair transplant. Joe, I never noticed it on you, so thanks for pointing it out. I'm not going to be able to stop staring at it now.
Now you'll never be able to stop seeing it. What's been seen cannot be unseen.
Anyway, man, listen, I hope we were able to answer your questions, and I'm glad that you've benefited so much from the program. And, you know,
Well,
go ahead.
Well, thank you so much for taking my call. I just want to say I appreciate you guys.
All right, man. We appreciate you as well.
Thanks for calling.
a lot. Take care.
Thank you.
Don't forget to hit the like button on the video.
Yes.
Thank you.
Hey, guys, the phone number is 888-659-3727. That's 888-659-3727. Everyone is trying to call and remember, as soon as I hang up, that means that there's a line open. So you will be able to get in if you call right away. 888-659-3727. Now, everyone in the chat's like, oh, Morty's going to be call number 2.
Maybe Charles Fay will be. He says, damn answering machine, LOL.
Hold on. Which button do I push? I always push it wrong. Hey, you're on the air. Who's this and where are you calling from?
Hello, gentlemen. It's Dave from Brooklyn.
Dave from Brooklyn. How are you,
Hello,
man?
Dave.
Quite well. How are you, gentlemen?
Pretty good. Pretty good.
I can't complain.
We were just trying to figure out how not to have Morty as a second caller. Maybe we'll have him as a third caller.
And Joe, I'm glad you recovered quite well from your little cold a month ago, right?
More than a month ago.
A month ago? More like, what was it, November? Almost 3 months ago. Yeah.
You mean when he almost died?
Shh, don't tell anyone.
Yeah, I won't.
Gentlemen, may I ask you a hypothetical question about finasteride?
Yes.
Yes.
Okay. Well, I know a couple of people who are trying to take the drug, but they're saying that they're having negative side effects and therefore they don't want to continue using it. And I've told them that both of you have mentioned that if someone changes their dosage, ramps up, or takes it maybe 2 or 3 times a week, they can slowly integrate it into their system. In your opinion, let's say 10 people claimed that they could not tolerate the drug. How many of those people would be able to tolerate it if they were to simply change the dosage?
That's a very interesting hypothetical that I don't know if we could really answer as far as percentage-wise. But
I'll tell you my experience recommending the approach that I've recommended for the past 15 years.
Yeah, it's almost 100%.
I don't recall having a single person get back to me and say that the side effects were so bad that they had to stop. I don't even recall any saying that I think maybe a couple, maybe 2, said that they did reach a threshold and then backed off to the previous month's intake regimen. And for anyone, and Dave, if you don't recall what that is, I've recommended to people after I tell them I'm not a doctor, that if they're afraid of side effects or if they've had side effects in the past, and they're still trying to figure out how to take the medication, try taking it just once a week for a month on a Monday, and see how that works. If there's no issues, negative issues, then they can consider upping it to twice a week on Mondays and Thursdays for a full month. And I say a month because that should give you enough time to notice any sort of side effects. And then if that doesn't have any issues, then consider upping it to 3 times a week, Monday, Wednesday, Friday, and then so on and so forth. And then if there is a new level that's reached where side effects are being experienced, and just back off to the previous month's schedule, and it should potentially work out for itself. And I've not had anyone say that they just couldn't take it after trying that approach.
Okay, I will definitely pass that along.
Yeah,
I think they'll be happy to hear it.
You know, and also I think it's important to state, obviously we're not physicians, but, you know, are these hypothetical people that you're talking about, or these people who aren't hypothetical, but the situation is hypothetical, I guess. But are they concerned about possible long-term adverse effects, like after stopping the drug?
Well, one of these gentlemen says that he has low testosterone, and he's very afraid of introducing this into his system.
Yeah, I think that's. I think that anyone who has that concern, in my view, should stay away from the drug, because emotionally, it's something that I mean, they could suffer from, a psychological issue,
Right.
psychosomatic effect, but they could also really suffer from it. And if there's any concern of that, then I would say, you know what, it's. I understand the value of giving it a shot, but you don't want to be on the other side of that thing.
Mm-hmm.
So,
and Spencer, just for the record, you still stand by your assessment that more or less most people can gain a decade or a decade and a half worth of hair out of this drug?
Out of a strip?
No, out of Finasteride, out of the drug.
I stand by that as far as my experience, my personal experience, and also the experience of everyone that I know who's on it. But there are people who just have much stronger genetic hair loss, and no matter what they throw at it, it's not going to. It's only going to possibly cause a temporary cessation, for a few years. But in most cases, people who catch it early enough will be able to maintain, a large percentage of guys, the hair that they have at the moment and whatever they regrew for at least a decade or more. And there's no solid evidence in that. This is all anecdotal. But I would say that in my personal experience, while I see things moving and progressing, it's been extremely, extremely slow. And even when I went through a recent telogen effluvium, and I was like, okay, my time has come, that's it. Just by titrating or adjusting my medication and changing a couple of other things in my lifestyle, I kind of feel like I'm back on track. So
Great.
To answer your question, I mean, listen, I believe in the product. It's really one of the only drugs that we have that we know works. But people have to they have to understand what they're getting into.
Okay. Very
All right.
happy to hear this.
All right, man.
Gentlemen, please continue doing what you do.
Thanks
Love
a lot,
your show.
man. Take care. Thanks for the call.
Take care, guys.
Thanks for calling, buddy.
Guy's got a great voice, man.
He really does. I'm telling you.
888-659-3727. Again, remember, every time we hang up, I know you guys are trying to get through, that means there's a line open. So we have a full board, but try to get in. There you go. Someone called in. Let's see who this is. I think I know who this is. Is this Morty?
Of course it is. Who else is it going to be?
How are you, man?
Third time's a charm. How you doing, Morty?
I'm doing good.
Well, they're really giving you some crap in the chat room about the Nigerian prince.
You know what? This is what you get for opening your heart to the internet. You know what I'm saying? The internet is tough, man.
Dude, you have no clue,
That's right.
my man. You have no clue what it's like to put yourself out there online. So whatever, and you know what's great about these guys? For the most part, I would say they're all just kind of just giving you shit like you're one of their brothers, you know?
That's how we go. We're all brothers in baldness, man. That's what we are. We're the Norwood Brotherhood, man.
Who the fuck ever thought that I would be
The
a
Norwood
part or kind of leading the way in this fraternity for so long? It's like a fraternity I never wanted to belong to.
So much so that you're doing everything that you do to keep out of it.
That's Jesus. So what's happening, man? How are you?
I'm doing good, man. I got some good news. So I don't know if I'd mentioned this back in December. I joined a clinical trial for vaccines, and so I had a visit to the office because they check your bloods every few weeks, and I put in a request to be unblinded because it's getting to be that time where I might become eligible for the.
Is that the erectile dysfunction trial? Oh no, that's not you. I'm sorry, Morty. Somebody else.
Babe, if that were the case, then I wouldn't be on finasteride. That's for sure.
I know.
But it turns out I actually did get the real vaccine. I found out yesterday.
Wow.
Yeah, man. So I'm done with this. I'm done with this crap, man.
Well, do you know that the antibodies? I mean, how did you react to it? How do you know? How do you know that?
Well, so
go ahead.
Yeah. So for the first injection, I had a little bit of arm tenderness, which at first I was very excited that I had a little bit of arm tenderness, and me being the freak that I am, about 2 weeks after that, I went and got an antibody test, and it came up negative. So I was like, damn it, I probably got the placebo, and I didn't think anything of it. And, but now we're getting close to the point where we might be able to be eligible. I got, I put in the request to be unblinded and told me they got it. So I'm not really sure. It's the AstraZeneca one, not the Moderna or the Pfizer one.
Right.
And so the reports about that one is that it's not quite as effective. I think it's like 62% effective at preventing infection, as opposed to like 94, 95%.
That's interesting. That's relatively low because just there was a recent study that came out of I think it was out of Europe that showed that just upping your vitamin D to create basically normal levels, maybe 2,000 international units a day, there was like a 34% decrease in infection rate just from vitamin D.
Yeah. I'm actually on vitamin D. I take about 5,000 units, and I'm a big believer in that in terms of because what it does is it helps to modulate the immune system so that you don't get these cytokine storms, which can cause your lungs to fill up with fluid.
Dude, I've been fighting my dermatologist over this for years. She's like, you got to stay out of the sun. We're going to have to cut some more stuff off you. I'm like, listen, it keeps me alive. That's how I feel about it.
True. Look, as long as you go to a dermatologist on a regular basis and have your skin looked at, and they take care of it, you're fine. But anyway, so that's one good piece of news. I'm going to go in for another antibody check because I'm just that crazy on Monday, just to see that I actually have them now. But yeah, I'm actually tonight after I get off the phone, I'm going to go have some dinner with some friends to celebrate. So that's one good piece of news.
That's great, man. So how do you feel? How do you feel about? And it's funny. I brought this up with somebody, and this is what's so interesting about our culture today and just the world. I asked them how they felt about what happened with Andrew Cuomo, and right away they're like, "Well, that was bad, but it's not as bad as Fox News." And I'm like, "Fox News? I'm asking you what you think about what happened in your state and this whole, every news organization that picked up the fact that apparently or allegedly this guy BS'd about how many elderly people he sent to essentially to their deaths.
No, it's true, and actually, the stuff that came out this week shows that it wasn't an accident. That there's actually evidence that there was some willful hiding going on, which is
that was the point. That was the point that I made.
The whole story,
and I'm just like,
yeah.
I'm just like, what does this have to do with politics or a news organization? It was on Politico. It was on Reuters. Everyone picked this up, but.
Because they reported, because I didn't know about that particular detail until earlier today. But I mean, 2 weeks ago, Letitia James had actually filed the case, and I guess they're starting to release some of the evidence, and that's what's coming up.
Well, what happened was Letitia James had filed the case, and then yesterday, Cuomo's top aide, his right hand person, basically admitted that they did fudge the numbers because they didn't want the information to be used against them politically.
Wow,
that was.
Now, I wonder.
Yeah,
I'm just wondering.
That's a big deal. Holy shit, that's a big deal.
And I brought up, and I'm just wondering if what's the what is the name of the organization that gives out Emmys? Is it SAG?
Is that what?
Emmys.
Academy? An Emmy.
Oh, yeah. Screen Actors Guild is what you're thinking of, but it's the Academy of Motion Picture and Sciences.
Yeah, I mean, are they going to come out and say, "Listen, we're going to take that Emmy back"? Someone going to go into his house and grab that shit? Is anything going to be said? Is Spike Lee going to come out and say, "Oh, you know what? I fucked up. I shouldn't have done that video"?
Oh boy! Wow.
I'm going to say probably not.
Well. All I'm going to say about that is I didn't vote for the man, so I don't really feel bad about it. You know.
Yeah. Well, I just think that it highlights the bullshit and the insanity of everything that's gone on with this fucking, this pandemic. Everything from every angle.
Yeah.
Except for this show, of course.
Well, you guys. I mean, let me tell you something. You guys have been the anchor in this freaking storm for me because, I mean, stuck in your house in New York City, can't do fuck all, scared out of your wits. What do I do on Friday? Well, I listen to the Bald Truth, and suddenly everything is right with the world. So
I think if everybody on both sides of the aisle just listened to the Bald Truth on Friday, their lives would be a lot better.
It's the great equalizer, hair loss.
Yeah,
doesn't matter what your political affiliation is. Hair loss affects everyone. And the great thing, Morty, is that in your case, you now have some positive info to put on your Tinder profile. I've been vaccinated during the tests.
Yes.
Let's do this.
Yes, that's right, baby. There's one disease you won't get from climbing into bed with me.
Exactly.
Check that one off the list.
Well, I think that's taken all the other.
But you won't get COVID from me.
Yeah, I think that's taken a lot of the other diseases off the table as far as like a major concern, except something that's going to kill you. But yeah, I mean, I honestly, they opened up restaurants, outdoor dining here in Los Angeles. I have to tell you, now that there's like several, a couple more strains, and there's one strain that seems to be more easily transmissible. I don't know if I want to go out and have a dinner with some waiter currently, at this point. I mean, and I think part of that is the media is scared the shit out of us to a point that, I want to support my local restaurants. I want these companies to be open, these businesses to thrive, but it's difficult for me to go out and enjoy myself.
No, I hear you. You need to get vaccinated, Spencer. That's all I can tell you, man. I mean, it's coming, but yeah.
Yeah, but then I listen to all the anti-vaxxers.
Oh, don't listen.
I'm just kidding.
Yeah, seriously.
I'm just kidding, man. No, I mean, I'm still. It's interesting because I'm in the demographic of 55 to death right now, but I'm still too young to get a shot.
I know because it's 65 to death for the access right now.
Yeah.
On the 15th of February, they're opening it up here to people with conditions. So, like, I've got borderline high blood pressure and borderline high cholesterol. So I could probably twist a doctor's arm to give me permission to get it, and that's why I went and got unblinded.
Yeah.
But yeah, I mean, if you have heart disease, if you have diabetes, if you have cancer, if you have any of those things, then you should be able to get one like right now.
Well, God forbid. But, and as far as the blood, I have white coat high blood pressure. So I guess if they took my blood pressure right there, it would be high.
There you go. Mm-hmm. See. So. Or you can go get a job in a McDonald's or working in a bodega, and then you can get one right now.
I think we spoke about that. It's not a bad idea. Take my mind off of shit too.
Go to your local bodega, man.
And you get free cigarettes.
Bodega and slip them. There you go. You go to the local bodega. You type up the letter saying, "To whom it may concern, Spencer Coburn works as a manager at the El Chico bodega, and he's faced with customers every day. Please vaccinate him."
You know what?
There you go.
Yeah, I'm just gonna have a sign around my neck. All right, listen, Morty, we're gonna go. We got other callers.
Sure. Absolutely.
And listen.
I want to mention a couple of hair-related things, though, real quick.
Yes, please.
So one of the things I wanted to point out is that you guys have given birth to a whole bunch of new YouTube channels from people who've called in the show, and I think it's kind of cool. First of all, I was watching Reliance's video. So shout out to Reliance because I see him. He's online.
He's a good guy.
And his stuff's pretty cool.
Mm-hmm.
And also, the chemist apparently now has his own YouTube channel.
Yeah, he's cool too.
Oh yeah, he has for a while. Yeah, he started it maybe I think 2 months ago. I think. Yeah. Yeah, so they're a couple of good guys. So we're glad to have them on board doing their thing.
You know, it's funny. I got a couple of interesting comments because we put a clip out of a chemist talking about finasteride versus Propecia and the possibility of having it appears that in general, based on it's all anecdotal, but just based on all the information that comes through us, more people seem to be suffering from adverse side effects, or when they make the switch, guys who were not suffering from adverse side effects either are getting side effects or their success, maintaining their hair kind of diminished once they went on generics. He was explaining why that's a possibility, and some people took that as took issue with that. We were somehow stating that Propecia doesn't have side effects. I find that fascinating. No, but it's like we can't just talk about our reality, or that there's a large percentage of people that take this drug not just for hair loss but also for benign prostate hyperplasia that have had success for many, many years. No matter what's transpired or no matter what the percentage of adverse side effects are. Yeah, clinically, it was noted that it was less than 2%, and they didn't list the fact that there was any long-term adverse side effects. Now they're finding information that this information about long-term adverse side effects was known. That sucks, of course. And if I knew about that, I probably wouldn't have even considered taking it back in the day. However, they didn't find that out in the trial for Proscar that I'm aware of. Only Propecia. So, anyway, I would say that I don't know why I just went on that rant. What did you ask me, Morty? What was your question?
Well, we were just talking about the YouTuber progenitors of the bald tree.
Oh yeah, and these guys are great, by the way. And that guy, the chemist from Ireland, he's a smart guy, and he's providing his experience and his expertise as an expert in chemicals, in drugs. That's what he does for a living. And I like seeing that information out there, and the fact that he's also a hair transplant patient, successful hair transplant patient.
I haven't seen this hair transplant. I just literally saw that. I saw that Reliance actually interviewed the chemist, which is kind of interesting. The other thing that I wanted to point out to Joe is that there are doctors out there who are doing reaction videos of your stuff. Matter of fact, this one particular doctor that I sent Joe an email about actually was very critical of your view of that particular boxer who had a beard transplant. I can't remember his name right now.
Yeah, no, I saw that. I wouldn't say he was particularly he was overly critical. It was kind of a 50-50. But what I noticed about his critique was it was on very small things, and it wasn't even accurate because the most common reaction I've gotten is when I talk about how growth of a beard doesn't usually go up to the bottom of the lip, to where the full area below the lip isn't usually it's not the most common thing to see where it's completely covered. But then my very next comment was there are exceptions. It's not across the board.
Yeah, it does happen.
And he just like every other commenter that zoomed in on that, he didn't take into the account that I said there are exceptions. It's not 100% across the board. And he says, no, that can happen. It's like, well, what? No shit. What the hell did I just say?
What did you just say?
It's like, what? Yeah. Yeah, I mean that's the only thing that
riding your coattails, man.
No, listen, honestly, he's actually a nice guy. He reached out to me, and he.
Oh, cool.
What's interesting about him is you kind of see him. His own process. He suffers from alopecia areata, so he's deeply involved in dealing with people with hair loss and his own experience. And I give this guy a lot of credit. This guy does not, as difficult as that is for any human being, This guy has not skipped a beat. I saw him on like Dr. Oz and some other places, and he just goes out there and puts himself out there and just talks about his own experiences with alopecia areata. So I give the guy.
That's true. That is true.
I give the guy a lot of credit. Now he did bring up one post that he made recently was about Tom Brady's hair and his assessment of him having a hair transplant, and he asked people's advice, what people's opinions were. And I have to say, based on everything that I know and doing this for quite a long time, I don't think that Tom Brady actually had any work done, at least in the temporal points, which is what's being pointed out. I don't think he's had any hair transplant work done. I actually think my view is that, they removed Finasteride from the anti-doping, thing for professional athletes, like in 2009. His first,
I didn't know he was on it. That's crazy.
Yeah, his first step would be, I would say, if he saw a doctor, they'd probably put him on that drug, especially when it was okay for professional athletes to use it. It looks to me like he was just a good responder to medication as opposed to having any work done.
That makes sense.
But that wasn't the assessment from this doc. So
cool. Gotcha. One real quick question. Actually, this is to you, Spencer.
Morty's not even
I already
listening.
asked this of Joe.
He's like, yeah, whatever. Okay, next. Go ahead.
No. I heard you about Tom Brady.
I know. I'm just gonna shit.
you love doing that to me, but that's okay. Real quick, what do you think of his work?
I think that from what I've seen, it looks pretty good. I know that he was working and trained under Jeff Epstein. He absolutely has, all I can say is this. If he was working under Jeff's umbrella and trained by Jeff, then he has a lot of time on tissue because Jeff probably worked him to death. So this guy probably did a lot of surgeries. And so he has a lot of personal time on tissue. So I would say that, I would have to take a closer look for sure. But I would say that he definitely has the chops or he has the ability to have the chops. And he's actually a real surgeon with a real surgical residency and a plastic surgeon. So combine that with good training for hair transplant surgery, there's no reason why he shouldn't be able to provide really good results.
Thanks, Spencer. Appreciate it. And, I really appreciate your honesty because I also know he's not a member. And despite that, you're still saying good things about him. And that's credit to you because, you're a good, honest guy. And, you basically are not afraid to say good things about people when they deserve it, and you're not afraid to say bad things about people when they deserve it. So, kudos to you, man.
Well, I appreciate that. And listen, why shouldn't I? If anyone's been thinking about any of these people, they should have a real assessment. That's it. Just the truth. Doesn't make a difference.
Yep.
All right.
That's right.
Morty, listen, you take care.
You take care, you guys.
All right.
Have a good one.
Take care. Bye-bye.
All right.
Take care.
Thanks for calling.
888-659-3727. Guys, again, when we drop a line, you can try to call in again. I know people are contacting us saying that the lines we still don't have a busy signal. And you know what? That's my fault. I got to call a company to set that up. It's still going to a voicemail.
Really
That means I know I do. I got so much on my plate. Here's my biggest problem. I don't have a personal assistant. You know why? I don't trust anybody.
That's true. That's true. You don't. That's hilarious.
I am not a person. I've been doing this for a long time, and I do some other stuff, right? And I could trust people with some other shit. But in the hair world, there's very few people that I can trust who will understand how to handle things that need to be handled. So even at the age of 55, I pick up my own calls. Now, I'm not saying that makes me some sort of like, well, I guess it does make me unique because you try to call one of these docs or whoever else in the industry, you got to go through 10 layers of people before you get to them. But I still find it necessary to do that. So that means even the small stuff, even an edit, I have to be involved in because I don't want the wrong information to be put out there. Let's take a phone call. Hey, you're on the air. Who's this and where are you calling from?
Hello, can you hear me?
Yes.
Yes.
Oh, okay, I got through. How you guys doing?
All right, who's this? Where are you calling from?
Doing pretty good.
My name is Yeah, I'm doing good. Yeah, my name is Reese. So I have a interesting question for you guys here.
Sure.
If you've ever heard of this.
First of all, tell us where you're calling from, Reese.
Yeah, I'm actually calling from overseas. I can't say where I'm from. I am military.
Okay.
Military.
Right on.
Awesome.
Okay.
All right. Thanks for your service, man.
Thank you for your service.
So, my pleasure. So I'm in my early 40s, and years ago, when I was younger, I had a condition called hyperhidrosis, where I had extreme facial blushing and sweating.
Yeah.
So I had a surgery in like 2002, and called ETS, where they put a clamp on the nerve.
Yeah.
So my face no longer blushed, and I didn't have any of the sweating. Okay. So the surgery was a success. You know, it helped me out tremendously in my personal life and social life. But the only side effect I had was the oil production in my face went crazy because I couldn't sweat. My face couldn't sweat. So the oil took over. You see what I mean?
Yeah.
Okay. Yeah.
So, so I never had any acne issues when I was younger. And so I didn't really have acne with the increased facial oil production.
Yeah.
But what it did was it affected my hair tremendously.
As far as the appearance of it, as far as you started to lose more hair.
Well, I was losing my hair anyways.
Okay.
Male pattern baldness runs in my family. So I was having those issues anyways. But it kind of compounded the issue because I was using Minoxidil at the time, the liquid, and it was just a mess. So that really affected things. And at that time, I finally got on Finasteride.
Right.
Yes, first. And then that worked really, really well. And then I eventually switched to dutasteride, which I've been taking daily for like 15 years.
Wow.
And so fast forward till now. So I've never had any side effects, and amazing results. My hair is better now in my 40s than it was when I was 19 or 20. You know, it's like incredible that I've maintained all this time. But I also had an excellent
just be careful, man, because we're going to be called dutasteride shills for allowing you to say to speak your truth.
Okay, I'm just trying to tell you my experience. But,
I love it. I love it. It's great.
So, anyways, I had an excellent hair transplant.
When did you have that done?
In Canada. I had that in 2008.
Okay.
Something like that. And I don't know if you guys talk about names on here, so I won't say the name.
You can say whoever you want. Yeah, we love
Go
names.
ahead. You can say whatever you want.
Okay, it was Dr. Rahal in Canada.
Uh-huh.
And
Dr. Rahal was one of our close to one of our founding members in the IHRS.
I do know that.
Yeah,
I do know that because I follow you guys. So Dr. Rahal restored my hairline because at that time I had the thinning just in the hairline. Okay, so I had amazing results with these medicines and with the transplant for all these years. But the oil was just always an issue. But it wasn't just the greasy of the hair. It was also with the face. I was always using those oil blotter sheets and whatnot. So what happened was a couple years ago, and this is where I'm getting to my point here.
Sure.
I promise.
Yeah.
But
it's a good story.
A couple years ago, I got on a micro dose of Accutane, which is isotretinoin, orally.
Yeah.
Okay. So I just did a microdose. Usually the prescription is 40 milligrams a day for that medicine.
Yeah.
So I was taking 40 milligrams a week.
Yeah.
So I was just taking 2 20-milligram pills Monday and Thursday, of every week. And the oil just completely soaked up. My skin is flawless. You can't see a pore. But also what it did to my hair was incredible. Like, my hair is like I'm 16. Like, it totally, I'm not saying that it's the miracle pill here, or that anyone else should do this. I'm just saying it's very interesting.
Well, that is pretty fascinating. Now, are you saying now is that continued? Are you calling us because that's things kind of reversed, or are you calling us just to tell us that the Accutane pumped up your results?
Well, I'm calling. Well, my question is: have you guys heard of anybody else doing this? And have you ever heard of it? I've been using it for the past couple of years at this super low dose. My blood work is always perfect.
I can tell you that this is the first time I've ever heard of it usually, and that's why Joe sighed or made that face when you said Accutane. Sadly, the normal dosage of Accutane is in many cases for people who've contacted us, is what started their hair loss process or exacerbated their male pattern baldness. But what's interesting is you're a unique case.
Right.
You're a unique case because
well, here's the thing, though, guys, is the microdose is the key for me personally.
Yeah.
But my situation, and to all your listeners, I'm sorry, guys. My situation is unique.
Yes.
Because my oil production was on overdrive.
Right.
Because of my previous surgery, so my oil production got down to normal, and it really made a big difference.
And I think that's a fascinating.
No, it makes a lot of sense.
Yeah, this is a fascinating case that I'm going to actually maybe put this out there for certain physicians to hear as well, because I can guarantee you that there are people in their practices that have come to them with similar issues. Maybe not after having that surgery, but that type of overproduction of the heavy oil production of their scalp and their face,
right?
Compounded with their hair loss. This could be something that could help a lot of people. Who knows?
Well,
and just so you know, I winced because in my career, when it was first available for patients that had bad acne issues, we would have a lot of people come in and tell us that it exacerbated their hair loss. But what we also discovered is that patients that had been taking it, they would have residual effects for up to a year after cessation of use, where like grafts would not grow. They would not recover from the transplant process. And so like now, some clinics I know of, they won't touch a patient if they've been on it in the past year, or like even a year prior, they won't touch them.
Right.
It's just too much of a risk. So for what you're telling me, aside from the hair thinning issues that you can also get from it,
right.
Your story is literally the only one I've heard that had a positive outcome for your hair. Never heard anyone say that before. So congratulations. I mean, it's a phenomenal outcome for you.
I think it's pretty amazing.
For me.
Yeah.
But the thing, guys, is you guys, and I hear what you're saying, Joe. Completely agree. But the thing is the microdose is the key for me personally.
Yeah.
So usually people, the people you're talking about, the guys you're talking about, take the normal 40 milligrams to 60 milligrams a day.
Yeah.
I'm taking just 40 milligrams a week.
Yeah.
You see what I mean?
Absolutely.
There's total difference between the two.
100%. That's why. But Joe just winced at the idea when you started to tell her story.
No doubt.
When you first mentioned Accutane.
Right. I get it. I get it. Yeah.
But I think it's fascinating, and I think that it's like we just said, great for you. You solved a lot of your issues over the last 15, 20 years. And you said you're in your 40s now with a full head of hair like you're 16 years old.
Oh my God. It's crazy. I mean, my hair was outstanding from the transplant and from all these years of
and you've been on dutasteride for 15 years with no adverse side effects. I mean, you're incredible. It's great. Jesus.
Wow. Listen, I'm very happy, but I just figured I'd share that unique story with you guys.
It is a great story.
One other quick thing, and I'll let somebody else talk on here.
No, you're great.
The next thing, I'm seeing all over the place. I'm sure you guys have talked about this. and have seen this too. The microdosing, once again, a super small dose of oral minoxidil. And I'm only bringing it up because I've been using minoxidil twice a day, and I've tried switching to once a day multiple times, and it was, it didn't work. I had a lot of shedding, and then eventually when I went back on the twice a day, and everything just came right back. I didn't have any issues.
Yep.
But it seems like my scalp likes it twice a day the most. And I've been using the foam since it's been on the market, 5%. So from using it all these years, and now I'm seeing this, because I've had success with the microdosing of the isotretinoin, the Accutane, I thought, well, wait a second. If I do a microdose of the oral minoxidil, would that be something? So now I'm like looking into it, and I don't want to rock the boat because I'm doing outstanding.
Yeah, I was going to say that.
I'm just curious.
It's good to know. It's good to know all about it, and to have it on hand.
What do you guys think about that?
I can tell you what I think. I think that we had a guy from Spain, physician from Spain, do a talk at the Global Hair Loss Summit about the use of oral minoxidil in his practice, and the results were outstanding. And what he was discussing was really interesting. And I can tell you that practically, or at least every IAHS member who contacted me after the conference, they all started to prescribe the same dosing that this guy was, oral minoxidil, and they're starting to see results now that are very positive. So I look at it as, wait a second, all these years I was personally concerned about potentially getting on it if I ever needed to. I have less of a concern. And I agree. I'm not a physician. I have to put that out there. But I agree with going with microdoses for a lot of these medications initially.
Right. Yeah.
So I do think that this is another tool in our arsenal that really was kind of ignored for many years, and a very small handful of docs were prescribing it to their patients, but with always this real risk, this preface stating that this is usually not prescribed this way. Obviously, it's off-label, and there's a risk of heart issues and this and that. Now they're finding that people can be on small doses for long term, and they seem to be doing really well.
Well, that's encouraging. Now, let me ask you guys this: would either of you personally consider it for yourselves?
Yeah, I can say that if things were to just go fucking downhill, start to really, I would absolutely add it to my regime for sure. I would give it a shot.
I considered it about 7 or 8 years ago. I talked to Dr. Wong about it, and we discussed the side effects, and I decided that I was not interested in doing it at that time. I've always had it in the back of my head because I keep hearing people talking about their results with it, and then of course this one doctor from Spain that Spencer was talking about. I edited his video for the Global Hair Loss Summit that we had just back in December, and I went over it probably like 30 times, making minor changes for the presentation. But I was very interested in considering it again, and I've not really gotten into it simply because life, but. It's always been in the back of my head.
Yeah, but you're also doing well
at some point.
You also look good. You're not losing any hair currently. So
why that's the thing. That's the other thing is I'm not anxious to screw with what works so far.
And it could also have the positive side effect that if you're borderline hypertension, have borderline hypertension, or high blood pressure, it could help you out in that respect too. I think Morty added it to his regimen, if I'm not mistaken. So
well, the thing is too is if I were to try it, I would do the extreme microdose. I think for men, all the studies and all the research, because I've delved into this, has been between 2.5 and 5 milligrams a day.
Yeah.
Now I would cut the 2.5 in half and maybe cut that in half.
Sure.
If I was to, because microdosing, and the thing too, with your listeners, everybody needs to understand, and you guys know this, each individual is completely different. we all have different responses to these things.
Right.
Now, my body is extremely healthy. I'm extremely fit, lean, and very healthy. So anything, and I don't do any drugs, smoke, drink, anything that affects your health, right? And I'm a fitness fanatic. So with my body being so healthy, a microdose of something, my body's very sensitive to any medicine that I ingest.
Yeah, I mean, did you see Tom Brady trying to get off that boat the other day? Because he doesn't drink? Yeah.
Exactly. There you go.
Yeah.
And that's funny because, Tom Brady and I are exact same age, and I played football in college too, and I watched him in Michigan, so it's very interesting.
I'm a big believer in what you're saying, and sometimes it's hard for people to hear, especially a guy like yourself who has done so well on all these medications. No adverse side effects that you're aware of. There are people out there that try the normal dosage of, say, Finasteride, and they experience severe adverse side effects. And no one fully grasps the concept, which I don't understand, that every body, B-O-D-Y, reacts differently to everything that we put into our body.
Something interesting about that? You made a good point there. Finasteride gave me issues, but dutasteride gave me nothing.
That's interesting.
Very interesting. Yeah, and when I tried, there was, over the course of those 15 years, I switched, I think maybe just a couple times, back to Finasteride, because, the scaremongering on the internet with side effects and whatnot, and the long-term, repercussions of the medicines. And every time that I did Finasteride, like when I initially started Finasteride first, before I did dutasteride, my body was very, very sensitive to that, as opposed to dutasteride.
Now, what were you experiencing? I'm just curious.
No issues.
No, when you're saying they were sensitive, what was
on Finasteride?
Yeah.
Yes. It was just, let's see, as far as like libido and stuff like that's never been an issue. So your listeners, don't be scared about that. For me, anyways, in my case.
Yeah.
It's just the...
Oh, my case too, but I can't say that. If I say that, I'm a Merkshill. I can't say that. You know what? I've been on this drug for 30 years, and I honestly believe, at least even at my advanced age, I honestly believe that everything's functioning practically as well as it did when I was in my 20s.
Spencer, listen, dutasteride has enhanced my libido.
Yeah.
My testosterone is through the roof.
Yeah.
And that's a lot of things. I don't know if your listeners, I'm sure a lot of them are educated and know this, but the medicine actually increases your testosterone. And, I'm not going to get into the nuts and bolts. Everybody who's listening probably knows.
It increases your free-flowing testosterone, and it can increase it to a level that, at least with Finasteride, up to 15%, which is not insignificant as far as maintaining muscle mass and living your life.
Yep, and dutasteride, my testosterone is through the roof. I do blood work, every year, of course for my job, but for multiple reasons, and my testosterone is always through the roof, and the doctor's like, man, whatever you're doing, keep it going. But
I think it's because you're lean. And you're training all the time. If you're under 20% body fat, which is still high for some people, but if you're within that range as a grown man, your likelihood of having low T in quotes is much lower than the average American.
My body fat's always under 10, around 10 or 9 or something like that. So it's extremely good.
I got this BMI scale, body fat, and I got to tell you, it depends on the day. Sometimes it's like it goes as high as 16. I'm like, what's going on here? And then the next day it's like 14 or 13.
That could be fluid. That could be liquids messing with that number. So I won't really pay attention to that too much. That fluctuation. The body fluctuates normally every day.
Yeah.
Every hour, so to speak.
Yeah.
During the day. So.
No, sometimes I get on that thing. I'm like, why did I buy this fucking thing? You know? Anyway, go ahead.
That's hilarious.
Yeah.
Well, listen, I don't want to take any more of you guys' time.
No, listen, great call, man, honestly. And I want to thank you before you finish. Yep. Thank you for your service. And thank you for the information that you just provided all of these listeners and viewers, because it's inspirational. You know, everyone has their own story, and you've been through something that was pretty unique and tough to deal with. You actually had to have a procedure to deal with something that, you know, most people would never understand. And you were dealing with male pattern hair loss, and you had a hair transplant. You've been through a lot.
Spencer, I was in college when all that was going down.
Yeah.
And I was a star football player.
Yeah.
But I never went out socially. And I'm not a party guy anyway.
Yeah.
You know, I'd be at the gym training on Saturday night.
Right.
You know what I mean?
Yeah.
But but the extreme facial blushing, like I couldn't talk in front of class. Like it affected everything with my life.
Of course.
Socially and whatnot.
I bet.
So it was a big deal. So when I had the surgery, and it was such a success, but also in college, sorry to rewind, dealing with that hyperhidrosis, facial blushing, and on top of that, losing my hair, that sucked.
Yeah.
You know what I mean?
Yeah.
In college, like being a football player, I would take my helmet off at practice, and it'd be a million hairs in there.
Yeah.
You know what I mean? And I wasn't doing any treatments at the time, of course. But and that was a long time ago. You know, that was in the late 90s. So
well,
it was crazy. But
you came through it, and you came out the other side. And I think it's important, again, people who, you know, I tell people, you know, when people tell me, I'll try to make this short, but I was having a discussion with a physician the other day who is applying to the IHRS, and he knew about me for many years. He's actually a guy that one guy listened to the show when he was in college, which is interesting. That's how old I am. And he was talking about, you know, what he's heard about me through colleagues and all the nonsense that I've had to deal with, and just the resistance to me doing what I do and being in the position that I am, and you know, exposing the truth about the field. And he also brought up some stuff that, you know, he heard me saying about shit that I get online and all that stuff. And all I would say to him is, like, you know, in my view, you know, to me, it's just, I just survived all that, and that's why I'm here today.
Yeah, no doubt about it.
And that's it. You know, like,
no doubt about it.
From this day on, I don't even think about that shit. It was just like, okay, this is what I had to deal with to navigate myself to this point in life. And that's to me, it's an inspirational story. What you know, you calling in, telling us what you had to deal with.
Well, listen, it's a really fortuitous phone call, because it's like going on midnight for me over here, overseas here.
Wow.
And I saw you. I was getting ready to go to bed. I saw you guys, you know, started on YouTube Live there, and I thought, you know what? I've been meaning to put my story out there, and I'm just going to take a chance. And I had to keep, you know, redialing there a lot to get through, but I'm glad I did.
Well, I'm glad you did too, and, you know, thank you. And listen, feel free anytime, give us a call.
Yeah, my pleasure. And listen, I've been following both of you for years, and you guys really helped me over the years. And you know, like you said, all the stuff you have been through, both of you. And you know, I never paid attention to any of that bullshit. And I'm pretty sure that most of your listeners don't either. You know, the guys who really know what they're, you know, what they're talking about.
Wow.
So I really appreciate the show. Really
thank
appreciate both of you guys. And yeah, keep it up.
All right, man. We will. Listen, take care.
All
And
right.
again,
stay safe over there.
Thanks for your service, man. Take care.
All right, my pleasure.
Bye-bye.
Take care. All right, bye.
Bye-bye.
A great call. 888-659.
Yeah, real good.
3727. Let's see who this is. Hey, you're on the air.
That's all.
Oh, yeah. That's what we're here for.
Mm-hmm. Yeah.
Okay. So at the moment, I'm 40 years old, and I have temporal recession.
I have to stop you for 1 second. It sounds like you're either calling from a computer, or it's kind of a weird connection. Can you?
I'll try again. And sorry.
You want to call back?
I'll try again.
Okay.
Yeah, I'll call back.
Okay, we'll take another call. You call back.
Thank you.
Thanks. Hey, you're on the air. Who's this, and where are you calling from?
Oh, hi, it's Jack again from London. How's it going, guys?
Hey, Jack, how are you, man?
Hello, Jack.
I'm good, guys. Yeah. So, firstly, sorry for my UK colleague who failed to use the phone just now.
I think hopefully he's back. He's on hold again right now. We'll see.
No, firstly, I didn't know about the UK show. Like, I've heard about it, over the years, but I didn't know you're still doing that. Like, you lads you've got to nail down your marketing game because, we're living in the age of the podcast, and
well,
you've been doing this.
Things are changing. Just to let you know, it's going to be. I don't know if you know the grooming blog Ape to Gentleman, but it's going to actually be airing on there. I think starting next week.
Okay. Sure. Yeah. No. Because I genuinely think that like this show.
Now I'm actually motivated to make this what it should be because there's just so. It doesn't matter how long I've been doing this and how hard we've been trying to change people's perspectives and perception of dealing with hair loss. It's just getting worse, man. So we got to try harder.
Yeah. No, understood. Well, there's charges.
Sorry about that, man.
Sorry about that.
Don't worry, Spencer. Don't worry. I'm sending you the invoice. So.
Yeah, we'll send that over to Specs. He's closer to you.
Oh man, it's funny. I actually listened back just yesterday to the show where I did call in the other week.
Yeah.
And it's really funny. Earlier on, you guys in the show, because I wasn't listening at the time, you both are kindly imploring not to use bad language, and then I come on half-loaded, swearing my head off. So apologies. Apologies for that.
No, it was more about me using the bad language.
It happens. We get it.
No, I appreciate that. Well, I've actually had a hilarious week. So
yeah,
I got a notification on my trading account. Right, pops up on my phone. This wasn't this week. This was last week, and it was like it like exploded over 10K. And in the back of my mind, all I was thinking was, "Holy effing, X." It's Replicell. Replicell's making it, and actually, it was GameStop. I was one of the early GameStop guys.
Yeah.
I was weirdly disappointed that I was like, oh man, I hope it was Replicell. Jesus, those guys are still going there.
That's hilarious. Actually, yeah. Did you sell?
You know what? I'm a complete classic retard. I got out at the very peak. I got out it turned into this weird social thing online and in the news where it's like this thing like people against capitalism, but take it from me, like that's not how that forum started. It was people trying to make a quick buck, and luckily for me, it worked out.
Yeah. No, you know what? It's good that you got out.
Yeah, it was a bit of fun to be fair, but anyway. So I thought I'd call in today just with a couple of choice questions. So I thought that might be maybe valuable for your listeners. Obviously, I'm not totally clear on the answers either.
Sure.
So one would be
neither are we.
Yeah, well, I'm sure you shed some light on the topic.
Sure.
Minoxidil foam. So I I said last week I had a great response I use it's branded Regain in the UK, I guess Rogaine in general. But I have a theory about it, and I'm not sure about this. Obviously, this is why I'm asking the question. Where I will use it, and if I stop using it, literally within days, my hair, I notice the texture, the thickness gets considerably worse, and it kind of led me to a kind of conclusion that actually a lot of the benefit of using Regain is actually it's almost like an aesthetic, like it clings to the hair, almost like a cover up, almost like a type of topic almost, and I can see when you brush your hair vividly, because I use a lot of Regain. I don't kind of follow the prescribed amounts because I'm crazy, but it like the white flakes fall off, and everyone online goes, "Oh my god, I've got dandruff." It's like, it's not dandruff; it's the literal Rogaine particles. Right. But I'm thinking, is this really actually supporting the follicle itself, or is it actually clinging to the hair, coating it? And it's not like I'm going to stop using it, because to be honest, if it looks good, it looks good. But I do think sometimes, maybe it's not really making my hair thicker, the shaft diameter thicker. It's literally clinging to the outside. and making it appear thicker aesthetically.
It's probably doing both, and if it wasn't doing both, you would see a regression, or you would start to see things getting, it wouldn't be looking as good. So even if it does have that thickening effect, which a lot of, you can get a thickening shampoo, stuff that coats your hair like the foam does. If it wasn't working for you at all, I mean, let me ask you, and I forget, you're probably on Finasteride as well, right?
Yeah, I've been on Finasteride since, I guess, 2010, something like that.
Yeah, so it's hard to really know if it's working for you or not, but since you've been on it for so long, frankly, you don't want to stop it anyway, because you're going to go through a shit.
I appreciated, the kind of message over, my research of, if you stop Finasteride, you better hope to hell that you don't go through diligent effusion, because it's quite possible, quite likely even. And I only jumped on the Rogaine as a kind of last resort, because Finasteride, I'm one of those people where you don't really hear about us so much, because a lot of people get on Finasteride and they expect these great results, and as soon as there's no great results, they go, it's not working. But I never had great results. I never had the obvious great results of massive regrowth, but what I did have is I didn't really see a massive regression.
Right.
So I just kind of thought, well, you know what, if I'm on it and I'm not getting worse, then I'll assume it's working.
That's correct.
So yeah, and it did very slowly. It has got I've been on it for 10 years now, so it's got worse gradually. But I don't put that down to the failure of Finasteride. I probably have quite aggressive genetics for hair loss, so I kind of see Finasteride as doing maybe 75% of what's needed. So I needed to kind of fill in a 25%.
But also as you age and as things change in your body, your hormones change a little bit as well. So I mean, it really there is no logic to the concept that on all the online bro science that Finasteride has a 5-year expiration date or a 10-year expiration date. It could, as long as you take the drug, it continues to do what it's supposed to do. It's your body that changes over time.
Yeah, that's interesting. The concept of there isn't really this tolerance level that built up with it, which is obviously beneficial. To be honest, unless I reach a critical mass where I really believe that it's not done anything. Why would I not take it? I mean, it's not cheap, but it's not really expensive, in the context of things.
All I can say is if you've had success, and you have, and I'm not saying this just for you, I'm saying it for our listeners as well. What are you drinking?
Oh, I'm actually drinking pineapple rum. Sorry.
Oh, good for you. That sounds good.
Hey, it's lockdown, guys. Come on, give me a break.
Good for you. What was I going to say? You know what? This is what happens as I'm getting older. I'm losing my train of thought. I'm going to let you ask another question or finish your thought, because I just forgot what I was about to say.
Yeah, well, so the first question was essentially, is it fair to assume that Rogaine, or Regain in the UK we call it, is actually, the worry I have is that it's just thickening my hair aesthetically, but then I have this other thought, on the other shoulder that's saying, no, it's thickening your hair aesthetically, but it's also doing a great job properly penetrating the follicle and making it healthy.
I would say that the assumption should be number two, and that it's doing both. So right, there is probably, and it's known that there could be a cosmetic effect for sure. But that, to me, that's just a benefit of using that particular type of Rogaine or Regain.
Right. Yeah, and look, it's not like I'm complaining. At the end of the day, if it makes your hair look thicker, I mean, that's the goal. Right?
I paint my head, man.
You know what, Spence? So do I. I stopped recently because I fell through this kind of critical mass of being able to get away with it. But I'll tell you a very short, funny story. Years ago, I was at university. I rigorously painted my head at university, and it looked actually quite good. No one ever spotted it, no one noticed it. And then one night I was out in a club, it was in Cardiff in Wales, and I essentially fell over. It's a long story short, I essentially cracked my head open to the point where I needed EMTs.
Oh my God.
And they came, and it was really funny because at the time I was maybe 23. I'd kept it absolutely deadly secret to anyone. I hadn't confided in anybody that I painted my head. It was a real, like now I do sometimes do it, and I'm really open about it. I've taken that approach. It's liberating. Anyways, back in those days, it was like my kryptonite. If someone spotted the paint, it was like the end of everything. So anyways, I'm on the floor and I'm bleeding quite heavily out of my bloody head. And they call the you know the people in the public see, and they call the EMTs, and the paramedic come, and I'm kind of out of it, but I'm not totally out of it. So they're asking me questions, and they put me in the ambulance. And one thing I never forget is that they were like,
"What's this on your head?"
No, literally, they thought I'd kind of cracked into the brain, like the spinal fluid or some shit. Like they
really?
Sorry, excuse my language. Yeah,
what?
Well, they were unsure. For them, what was happening was the hue of the actual. I think it was Couvre at the time I was using. The hue of that
mixed with blood,
mixed with my blood, was making this orangey yellow color.
Oh my God!
Down my face.
You fucked them
up.
And
they were looking at each other, and I remember looking at them, talking to them, and they were looking terrified. They were like. Right, Governor, he's got a breach of the...
right, Governor, bloody hell.
And I'm like... and then the guy's flooring it, and he's putting on the sirens, and I'm like looking like, oh my God, what's going on here? And then I kind of clocked it, and I was like, no, this yellow stuff, it's not my brain. Like, I paint my head. And they're like, right, he's confused as well. He's confused.
Yeah.
Out of my mind.
He's confused as well.
Yeah, they didn't understand. And then I had to really explain, no, I paint my damn head because I'm losing my hair. And eventually they kind of laughed. I was like, I guess it's better than breaking my skull open and my brain bleeding everywhere.
As they would say in your part of the world, that's brilliant, man. That was a brilliant story.
And then the next question is, did they start asking you questions about how you fight your hair loss? Because one of them's losing hair too. Like, were they like, oh, wow, I didn't know you could do that. Tell me more.
They, in classic fashion, they both had these perfect Nord 1 like hairlines. They were like,
of course,
completely oblivious. Like, what the hell is he doing? You're painting your head? But they found it funny, and you know what? Weirdly, that was my first experience of. Actually, it's quite liberating telling people. And then I started to tell people shortly after. Like, I didn't tell people immediately, but I started kind of just saying it because actually. You shouldn't be, ashamed of doing that, and actually, you take ownership of it by saying, "Hey, I paint my head, so what?"
Yeah,
like, it feels better.
That's the story of my life, and I will say that what I always found fascinating when I got the weird reaction from like some at a party or some, a woman saying, "Well, what do you mean you paint your head?" And my response is, I mean, your entire face is painted.
Their entire, you know how you paint your face? I paint my hair.
They walk out wearing not all women, and I was lucky enough to be with somebody who didn't have to do that. But they they basically are wearing masks when they leave the house.
Sure,
it's a disguise.
You actually said it. You said this many times, Spencer, and I think once you said it, and it really stuck with me. Like, the people who really have a problem with it are just people you don't really want to associate with in the first place. Like, you actually, it's kind of a great filter because anyone who is to absolutely freak out and absolutely have a breakdown over the fact that I put makeup in my hair is probably quite like a shallow, weird person in the first place. Like, the most real people don't really care. They're like, oh, fair enough.
And even when I was young and I was single, even prior to common law, I would be like, look, I just sprayed my hair. Don't mess with it. When I would talk about my hair loss, or I had to do that because if I didn't put it out, and it didn't matter that I was 21 or 22 years old. And I think it really helped to prepare me for all the nonsense in life. But yeah, it is a great filter. There's no doubt. And I mean, there are especially young girls who are going to be like, well, that's weird. I'm not interested in that for whatever reason. That's okay.
Right. Yeah. I mean, it's exactly that. Like as I told you last time I called, like, I'm 29 now. Like, the older you get, like the less people give a crap about like those superficial things. Like, yeah, you paint your head, like, it's a bit weird. It is a bit weird, but like, in the scheme of things, is it that much of a problem? Not really.
Yeah. Well, it seems weirder than it actually is.
The older some people are, the more easy it is for them to understand because they're doing something that they may not want to share to enhance their older looks as well.
Right. Yeah. I think from the decade of your 20s, you kind of, it's not just us who are dealing with Norwoods. Like it's the whole population are dealing with some type of aging. Something dissatisfying about aging.
Absolutely.
So people kind of open up to it.
Do women wear the product Spanx in the UK? Is that popular in the UK?
Yeah, is that? I might be completely confused, but is that the legging type of
Yeah,
thing,
exactly.
right?
It basically just makes, it hides
it makes everything look great.
It makes everything look smooth and tight. Well, I mean,
yeah.
This is like, this woman is a billionaire who invented this thing. So
That's
women
mental.
for generations and centuries, I mean, they've been changing their appearance or hiding their flaws or whatever. So that's why I think, look, man, you do what you got to do to feel comfortable in your own skin. So listen, Jack, we're going to take some more calls. You're always great to hear from you.
Right. You know what? I'm really sorry that I spent too long blabbering because I just had a couple more questions, but I won't be. I'll be like, these are quick fire questions, right?
Quick fire. Okay.
Quick fire. Right.
Quick
okay.
five?
One is quick fire.
Quick fire.
As in, like, you can answer really quickly.
Oh, quick fire. Okay.
Yeah, sorry, quick fire. I take 1 milligram right now. I was thinking of upping it to not necessarily 2, but I've seen online that there's basically negligible increasing a dose. So I wanted to get your quick opinion. Is it worth doing? I was thinking about doing every other day, doing 2 milligrams.
My opinion is
that risky?
My opinion is if you are not currently going through any type of a change or telogen effluvium, or you're not noticing things getting worse, I would say no.
No,
I would agree.
Yeah.
Okay. And the last question I had was, how is Joe from Staten Island? Like, we haven't had this guy for years, man.
I have no idea. I have no idea, man. This guy he got upset, and he just decided to boycott calling in. Probably still listens
all because of me.
Possibly.
Well, you know what? Back in the day, like I liked him, and bear in mind I was younger. He had a real attitude of taking the bold truth and talking about the cure, quote unquote, and talking about the updates and the news. And I quite liked. At first, I didn't like it when you actually brought it back to more of a therapy type of session.
Yeah.
I thought that was bullshit. Sorry, excuse my language.
Yeah.
At the time, I was like, I really enjoyed the idea of talking about Replacel or Histogen or whatever. But actually, I think you made a really good move because I started to realize like it's a great show in itself, just talking about treatments and all that stuff. Because at one point, it was kind of talking just about future stuff, and it's not really.
And that's what everyone seems to want, the direction people want to go in. That's where the Bald Truth Talk was going in. I was just like, you know what, man? It's just we're giving people in some cases a tremendous amount of false hope. What about what you're dealing with right now? What's it? Let's talk about dealing with life as a hair loss sufferer and how to navigate this crazy.
And I've never been interested in that myself. It's like why I've never been one of these kinds of people that worries about something that might happen. And I've never been one of these people that gets excited about something that might happen or might not happen. Like, it's never resonated with me. And
but if you want to get a lot of traffic on you want to get a lot of traffic and sell ads on a message forum, then that's the direction to go in. Because sadly, you young guys, man, you're all over that shit. Or at least you were, the younger guys. I mean, it's just like, okay, what's next? We got to know what's going on.
Yeah.
And it's the end of the world.
And what's funny is what's next is no different than what was next 20 years ago.
Replacel shares. I mean, that's how much I got caught up in it.
I know. All right, Jack. Listen, it was a pleasure. You take care. Enjoy that rum.
With you guys, I will do.
All right.
Take care. You're doing good work.
All right. I appreciate that, man. You take care. Have a good weekend.
Take care, buddy.
Bye-bye.
All right, bye.
Hi. Yeah, I just wanted to make sure that you could hear me on my audio. Might be messing up, but if you can hear me, that's all good.
It's very good. So what's happening?
Yep.
All right. Good stuff. I'm calling from London at the moment, and I just had it's actually quite a quick question. I don't have a long story or anything, but
thank God.
I'm 23. I'm I'm quite early to the hair loss thing, and I noticed it when I was 22 a few months ago.
Wow.
I've been researching it for about 8 months.
Sorry to hear it. I'm glad that you found this so early.
Yeah, this is what I think. I think I'm quite fortunate to have caught it this early because I've been quite conscious of it, and I knew that I needed to act on it early if I wanted to stop it. I didn't really want to. I know some guys are not as fortunate to find it as early, and they wished it could go back. But I think I caught it at the perfect age. But essentially, what my problem is that I'll give you a bit of backstory about where I've got to. I've done research for about 8 months on how to keep it. I'm about. I don't really know where I am on the Norwood scale. I know it's like 1.5 at the moment, I'd say. So I've still got a full head of hair.
You know what I love about that there is no 1.5, and everybody all these kids online have been saying 1.5 for the last 15 years. But yeah, I know what you're saying.
2.5.
We get the picture.
Yeah.
Really, hair loss isn't really that visible, or it's not categorized until you're at a 2. Just so you know. So you're in good shape.
Okay. All right, good stuff.
Yeah.
I think at the moment, I
Yeah.
can, if anything, I can see like my hair going back a tiny bit, which is, so it's I got it diagnosed as well, so it's definitely androgenic. Yeah. But yeah, so I noticed my hair shedding, which is what caused me to go to the dermatologist, essentially. And eventually, long story short, I built up the courage to try Finasteride, 3 milligrams a week, just to spread it out, just to see how my body coped. And I didn't think anything of it. Obviously, I went down the rabbit hole of the horror stories, but I decided to just jump into it anyway, and just see how I got on. And for the first month, it was great. Like I had a boost in testosterone, I think, because my libido went up.
It's pretty common.
Yeah. It was. I felt confident. I felt I was on the road to. I just didn't even think about it really. But then I don't know if it was the side effects that started to come in a bit later, because on the second month I had a bit of sexual side effects, and things started to plateau a bit, and my stress started to rise a bit. And one thing that can't be placebo was gyno, and I started to get that feeling in my nipple.
Yeah.
That's probably the thing that ruined it for me in terms of like my progression, because I decided to come off purely because I didn't want gyno, and I know that's
a common, and that's the kind of stuff and the experiences that we were hearing about 20 years ago. So I mean,
Spencer, real quick, I got to jump away. Switch camera off me.
Yeah.
Thanks.
So yeah, I mean, I absolutely understand why you would get off, and it was smart to make that move. And obviously, well, I'm not going to say obviously, but how are you feeling since you've been off the drug? Not emotionally, but physically.
Physically, it was fine. It pretty much stopped. The sensation stopped as soon as I came off it, and that was reassuring. And I sort of hope. I'm annoyed that I didn't taper down, because I think a lower dose could potentially have helped it a bit. But yeah, essentially, I came off of it. The nipple sensation stopped, and the lump that was forming sort of went away.
Yeah.
I did have it a bit when I was a teenager, but that sort of went away as well. It wasn't anything drastic.
And that's interesting that that you just said that, because, again, this is not the gospel, people, but based on people who have contacted me for the last 23 years, that is one thing that seems to be relatively common, that a lot of the guys that experience, or some of the guys who experience gyno from the use of finasteride, when they think back, they had some degree of gyno during puberty, and usually it reversed on its own. So maybe that you're just genetically predisposed to it. That's a possibility. But go ahead.
Okay, yeah, that's interesting. So I came off of it, and annoyingly, I didn't get baseline blood works to sort of check my estrogen, but I got them after. Everything seemed normal, so there was no scares there. But around the same time, around the second month, I had, I think, ED issues, but I think that might have been purely stress related.
Yeah.
But what my question is that annoyingly, I feel like, because I've caught it earlier, I've done everything right. I've found, I've built up the courage to go on this medicine, but I'm not getting the results. I feel like I fall into the 1%, and I'm quite unlucky. So without the main drug being Finasteride, I think, because I'm so young, I'm only 23, is there point in committing to minoxidil? And I feel like that's the only effective drug that I should really be on. And if that doesn't work for me, then I don't think there's a lot of hope, which is disheartening because I put the work in and done the research, but I'm not really getting the result that I'd like to be getting.
Well, that's a good question, and I can tell you that once you start down the minoxidil road, a lot of people will experience kind of a telogen effluvium or a shed when they start it. I'm sure you've read about that. And there seems to be a relatively short lifespan as far as just using minoxidil in kind of keeping or having the cessation of hair loss. You may maintain what you have in the areas that you're applying the minoxidil for a couple of years. It could be something that you maintain for 5 years or more. But unless you're hitting it at the hormonal level, it's not going to be a long-term fix. And that's, again, right. I'm not a physician, but that's just based on all the experience that I have over the last almost 25 years.
I see. So I don't know if you're familiar with the Belgravia Clinic in London.
Sure, I'm familiar with it.
I called them. I didn't use any of their services or pay. I just called them for professional advice because it's quite hard to seek because obviously GPs over here aren't too familiar with sound advice. I wanted to hear from a professional, so I wanted to speak to someone that's been dealing with Finasteride and with hair loss and stuff, if you know what I mean.
Sure. I think that was a smart move.
Yeah, because they basically, I explained my situation, what I've said to you guys, and they said to me that we wouldn't advise you to go on a lower dose because what I was considering is 0.25 every day. Because if I don't have aggressive hair loss right now, surely a lower dose would stabilize it in a way. I noticed my hair shedding stopped when I was on it, and that was obviously a plus, but the side effects started to kick in. So I don't know if there's point in going on a lower dose at all.
Well, they don't want to advise you to go on a lower dose because they feel that there might be some sort of liability for them, and I think it's important that you actually seek the advice of a MD or a physician as well, just so that there's going to be a hell of a lot less concern about liability for them to give you medical advice than a company that has doctors, but that's providing you information as an advisor, someone just picking up the phone. And I don't know if you spoke to a doctor at Belgravia, but probably not, right?
Yeah, I didn't ask what she actually did, but she sounded like she knew what she was talking about.
Yeah, she probably does. I mean, because she's been in the industry for so long, or she's been around the industry, and she's in that business, but it doesn't mean that she was a physician. But it's possible that she was. I know it's difficult in the UK and dealing with your GP or dealing with, but you might want to speak to a dermatologist, or you may want to see a hair loss specialist in your area, whether they're a hair transplant surgeon, physician who specializes in hair loss and prescribes Finasteride. Those are the people that you want to speak to kind of to give you some really solid advice, and based on their experience. Remember, it's called the practice of medicine for a reason. And everyone's practice is slightly different. Everyone's experience is different. And if you go to a hair transplant surgeon who has a lot of experience prescribing Finasteride, they may be able to say, you know what, we had a case very similar to yours, and we titrated this patient onto this amount, and he was fine, or it didn't work out, whatever. So that's kind of the information that I think you're gonna need to get. But if you're asking my advice, look, you already had side effects. You got away with it essentially clean by stopping the drug. That's great. It's probably unlikely, given your experience, that you're going to experience anything differently than you've already experienced, meaning that if you got on it and then you've had side effects and got off it, you'll probably be fine. But it is possible to experience less side effects or maybe no side effects by lowering your dosage. So that thought process is right that you have. But you got to talk to a doctor about it, and you have to also, consider your options. I mean, could you live your life without your hair, or could you live your younger life with a noticeably receding hairline? Or, how would you feel if you just decided to do nothing and let it go? Would you be able to function and enjoy your life?
I mean, at first it was like quite a surprise, and I didn't take it very well emotionally. Like as any young guy does, as they notice it, it's quite an experience to go through. But the more I've been looking into it and stuff, and finding out that the main drug just doesn't suit me, then I've come to terms with it. It's going to be like a long battle regardless of what I do. So yeah, I don't know. I don't want to give up yet. I want to keep trying and stuff, but I've stayed clear of minoxidil purely because I know that.
Okay, well,
high maintenance.
It is high maintenance, and I honestly don't think it's great for the long term. But that's, again, I'm not a doctor. It's just based on my personal experience and the experience of countless people who have called us over the years. One of our members in the chat room said that since you're in the UK, you may want to contact Spencer Stevenson or Specs to see any physicians he may recommend as far as you speaking to them as well.
Okay.
But there are some. You can go to the ihrs.org and you can find a couple of docs who are in the UK, and you might want to pick up the phone and give them a call, and you'll find someone. They have some really good advisors who can provide you with information. You can actually, depending on where you are in the country, you could probably go see them as well. But yeah,
I'm in London.
Yeah, then it would be fine. So speak to a doctor about it. But if you want to keep moving forward, you know what your options are, and you have to figure out if it's worth taking another chance and using a lower dosage and seeing how you do with that. And only you can make that decision. But there's really, what else do we have? We have dutasteride. You have PRP, which, the right PRP can work if you're the right candidate and if you're going to the right clinic. However, that is a situation where you're going to have to continue the process twice a year, depending on who's providing it, and that can cost you several £1,000s every time.
Mm. Yeah. I've noticed that.
Yeah,
it can get quite expensive, especially the Belgravia. They charge about half. They send an email to me about $1,000 to $1,000 a year just to take finasteride and their minoxidil cream, which I didn't really want to do. So
I have one more question for you. Did you use brand name Propecia, or were you using generic finasteride?
Generic.
Okay. Well, listen, you should talk to when you speak to your physician, it's possible that you might want to try brand name. It's going to be more expensive, but it's possible that you might have a better experience on that. You could have a worse experience too. But, when you're talking about the brand, at least you know what you're getting 100% of the time.
Okay, I get that. Yeah, I'll try that out. I've just got one more question about SSRIs and how they might intervene with it and have...
Sure.
Is it recommended to be on SSRIs before or during or, whilst taking finasteride? Because I know there's side effects of depression and stuff, and I'm not really sure.
Sure. Do you want to answer, or do you want me to?
Well, I think the obvious thing is, first and foremost, we're not doctors, but secondly, I think is just as important is this is something that I personally don't feel comfortable discussing. Only because it's such a touchy subject, and you're talking about how you mentioned some side effects with finasteride can include depression and issues like that. So I don't know. I mean, I'm not real comfortable getting into that as far as answering that specific question, maybe to your satisfaction. I mean, Spencer wants to add something, it's fine, but that's something
now you're scaring me,
prefer
man.
to throw into a doctor. No, it's just, when we're talking about something, it's a serious subject, and I think that each case is very unique with how one reacts to SSRIs, with how people react to finasteride, and then when you have both of them in the same mix.
Here's the question: are you taking SSRIs?
We've already
now?
got a lot of questions.
Are you currently on antidepressants?
Yeah, so I took him for, I'd say, about 3 years, came off of it, and then started to go on recently again, and that was another argument for why I potentially shouldn't really be on it from the Belgravia. So, I mean, I was comfortable on it. I'm not scared of them. Like, I haven't really got any side effects, unless, like, maybe a little bit of libido change. But other than that, like I just didn't know if it's not really spoken about. And usually when I type it in, it comes up with the PFS Foundation.
So you were taking before you noticed your hair loss.
Yeah.
Yeah. Listen, so all I can tell you is that when I was younger, around your age, I was put on some old school tricyclic antidepressants, and actually I was on SSRI, like the first generation, for a very short period of time. My heavy depression started when I started to notice my hair loss at 21. And I chose personally to, get off of them because I wasn't feeling, they weren't making me feel terrific. So for me, it was like, you know what? I'm going to have to deal with whatever I have to deal with and move on. So I was lucky enough to start Finasteride while I was not on any other medication. So I can't give you any personal advice on that, but I can tell you that, the more medication that you put into your body, and this is just common sense, the greater the possibility that you're going to react to whatever's in your body. Does that make sense?
Makes sense.
Yeah.
Yeah. I get you. Yeah, but yeah, it's just haven't really explored it much. I didn't know if it was like a talked about subject or anything, but it makes sense. I'll consider that when I take it.
All I can tell you is that according to the literature, Finasteride itself does not have any other drug interaction, but that's just based on the literature. Everybody's unique physiology will dictate how they respond to drugs. So you need to speak to your doctor about that, all right?
Yeah, that sounds good. All right, yeah, I won't take up any more of your time. You've helped me a lot, so thanks for the advice and everything.
Well, listen, good luck, and let us know what you decide to do. I mean, I'm interested. And look, these are early days, as they say in the UK. So, you still have options. So just hang in there, and find a good doctor.
I just don't want to, 5 years down the line say that why didn't I act upon it, which is what a lot of people usually say. So like I feel like I'm sort of pressured in a way to make a decision now to keep as much as I can.
Well, I understand that. I would say speak to somebody who has a lot of experience, a physician, not someone who's just selling products or services. I think Belgravia, they provide a service, and they've been providing this service for a long time. But if you can actually sit down and speak to a doctor who will take the time with you, even if you have to pay for the consultation, and say you just want a Finasteride consultation, you want to be able to speak to them about your experience. Speak to someone who prescribes this as an MD a lot.
Mm-hmm.
Yeah. All right. Yeah, I'll do that then.
Okay.
I'll call back if anything changes or.
Yeah, we're here for you, man.
Yeah, let us know what happens.
Good luck.
Nice one. Thank you, guys.
Take care. Bye-bye.
Thanks for calling. So we've got 73 watching. We've got 65 likes. I think that you guys can do better. Thank you to whoever did dislike it. You took it down, so thank you so much. But we're going to take one more call.
We're only going to take this call if this goes over 70 likes.
Okay, that's a good condition.
Eat.
So Spencer's got to eat. Still 65 people.
This intermittent fasting thing,
there's 66. Okay.
Haven't had food in like
68.
18 hours.
We're almost there.
That's your favorite number, Joe.
And we've got it. What, 71?
Yeah,
Thank you so much. All right, so let's take this call.
The whole board lit up.
We got more likes than we do watching right now. That's great.
That's the way to do it. We'll take both calls quickly if we get over 80.
Let's do it.
Hey, you're on the air. Who's this and where are you calling from? Hello? Caller, you're on the air.
Hello?
Yes.
Oh, is it me? Oh, cool. Hi. Sam Payton, 26 from the UK.
Oh, welcome, man. How are you? We're getting a lot of UK calls today.
Yeah, third in a row.
We're okay. Doing a little show here. What's happening?
Good. Quick backstory to myself, I guess. Been noticing kind of hair loss since I was about 20, 21. Gradually receding. It runs in the family. Dad's got the usual halo top around his head.
How old are you now?
Which is good to see. My dad?
No, how old are you?
Me, 26.
26. Okay, so you've been dealing with it for a few years.
Yeah, so I'm got to a stage where I'm a Norwood 3, Norwood 4. Quite a lot of hair loss at the back in the crown area, though. Doesn't bother as much as kind of the temple regions, which affects me quite a bit, to be fair.
Okay.
Spoke to quite a few different doctors in the UK, different surgeries, kind of got their advice and their opinions. Now, I'm getting very mixed reviews from both of them. Half of them saying you're kind of too young, wait out a bit more, wait until like your early 30 or so and see where you get to. And half of them saying, well, you're kind of at an age where you can go for it, you can't go for it, wait a bit more. It's up to you. You kind of decide what you want to do best. So it's a tough one. It's do I get it done now and see what happens in the next few years, or do I wait for a few years and see what happens?
Are you currently on medication?
Yeah, Finasteride for 6 months.
Okay, and how are you doing on Finasteride for 6 months?
Fine. Yeah, I guess it's all with different people. My brother's been on for 12 months, and he's seen a big change in his hair. In essence, it's got a lot thicker.
Yeah.
So hopefully, I'm kind of following down the same path as him. I appreciate, obviously, each person's drastically different, but I'd hope that we kind of share same genes between myself and him.
You most likely do to some degree, obviously, and usually I've seen this in families. You don't have to be identical twins. Usually, if it's working well for one brother, it seems to work for their siblings. All I can say is this: if there's anybody that turned your money away, listen to them.
Yep. Well said.
That's it. Anybody who was willing to turn your money away, listen to them, because they could have just said, you're a great candidate, and hope that you sign on the dotted line.
Yeah.
Does that make sense?
I guess where, yeah, it perfectly does make sense. I guess where I'm kind of struggling at the moment is with the whole situation of COVID, I guess, throughout the world, especially in the UK. It's a good time, in essence, to get a transplant, because I'm working from home for the past year. I'll be working from home for the next 6 to 12 months. So, I mean, I'll have great downtime, great recovery time. I won't have to socialise as much as I would do before. I can actually spend some good time in the house and actually not have to go out in public and kind of have that embarrassment, should you say, of kind of exposing it. So
look, that's a reasonable thought process. I mean, that makes sense. If you're going to have something done, now is a great time to do anything, especially when you can recover and you're not having to go to work and you're not socializing on a regular basis. But the thing is, if you're not a real candidate for surgery, there is no good time to have it. So if you're too young, you could potentially cause yourself to be worse off than you are right now. If you haven't waited long enough to see if Finasteride did enough helped you enough where you felt comfortable in your own skin and you didn't need surgery, then you're not giving yourself a fair chance.
Fair point. No, thank you.
All right?
Yeah.
I understand. Listen, I get the anxiety of it. I know that, listen, now is the time. And if you have the money to do it, you want to do it. But surgery is always going to be there. And it's really something that you need to be ready for and think about, and not just do because it's good timing, at least, as far as your social calendar and your ability to not have to go to work right now.
I think that also you need to consider that any of the good clinics in the UK right now, all three of them, they're booked out for about 6 months anyway, because all their patients are thinking exactly like you are. It's a great time to get a hair transplant.
That's a fucking great point, Joe, that I didn't make. Damn it.
And and I think that you owe it to yourself to continue to give you the medication the time it deserves to do what it's going to do, just like it did for your brother. You said he's been on it for 12 months, you've been on it for 6. He's had a great result. This is about the time that you should start to see the beginnings of any sort of result if you are going to get a result. So give it more time, but also consider that the best time to have a hair transplant is when you're ready, not when it's convenient for work or because of a wedding coming up in a year or anything like that. I used to get this I still get this point a lot. I want to have a hair transplant because now's the time, due to this, due to that, due to whatever, that is the furthest thing away from what it needs to be, and that you've done your research, you've tried everything non-surgical under the sun to get your hair back, and you understand that there's not a guarantee with a result. All you can do is hope for the best, and that there's merit to saying, you know what if I just shave my head, see how that works. If I don't like it, the worst thing that can happen is it takes a few months for my hair to grow back. I mean, try everything first, because hey, now's the time. You're not going out, so shave your head. Try it.
Yeah, I just did that yesterday.
Use your same rationale. It's like you're not going anywhere. You're stuck at home, so why not?
So what did he say? Did you say you tried it, or you're going to try it, or you're not going to try
it?
Yesterday.
You
shaved your head. So how do you?
He
you
did.
Like it. But you know what?
Yeah,
I mean, it's going to take a little time to get used to, but maybe you will like it in a month.
Yeah, no, fair. Yeah, good point. Good point.
Listen,
I'd obviously take everything you said on board. Yeah, that's great. I will let the kind of the recommended time period, or the time period that you would see the results in, and then take it from there, I think.
Yeah, the worst thing that you can do to yourself right now is jump into surgery, man. I mean, you could regret that for the rest of your life. And just from a follicular financial point of view, meaning your donor hair is a non-renewable resource. Once it's gone, it's gone. Once it's used, it can't be reused. The other benefit to trying everything else other than surgery is that if you have a positive reaction to where you actually thicken some of your hair, that's less donor hair that you need for any surgery that you wind up having in the future. So that's another way to look at it. So you could look at it as a consistent manner of reducing the amount of surgery that you need in the future. Okay. All right, man. Listen,
thank you.
We're going to run. We're going to take one more call and call it a night. Thank you. Good luck, and let us know what you decide to do or how things go in a few months.
Thank you very much.
Take care. Bye-bye.
All right.
All right, last call. You're on the air. Who's this, and where are you calling from?
This is Ray from Florida.
Ray from Florida. What's
Hello,
happening,
Ray.
Man? One of the only free states left. What's happening?
That's true. I'm glad I finally caught you. I worked till 7 o'clock, and I'm always chasing you down, trying to get on the show again.
Well, I'm glad you caught us too.
Glad you made it.
Yeah, I've talked to you a couple times. A real quick synopsis. I had a hair system for 20 years.
Oh yeah.
And then I called you guys. Yeah, I called you guys and told you I was going to get a transplant, and you guys asked about my doctor. Then you looked on the website and showed me that the doctor's pictures weren't really his. So I changed my appointment. I canceled that, and I went with Dr. Aaron Nussbaum here in Florida.
Okay.
And 13 weeks ago, I had my surgery.
All right. How are you doing?
Congratulations.
Fantastic. Yeah, I really am excited. I'm to that point where it's starting to pop out and feeling pretty good. I just wanted to really call and let you guys know that I started with a recommendation from your video, Joe. And after I read a couple of his papers, and I looked into it, and that's why I made my decision. So basically, though I have done a lot of research elsewhere, a lot of my major decisions were based on your guys' show. Not that it's your responsibility.
So no pressure on us.
Yeah, no pressure, dude.
No, I just wanted you to know that somebody's actually listening to you.
No, I appreciate it. Listen,
that's always appreciated, for sure.
We just provide you what what we believe is to be true, and that is it. And I'm glad that you made the decision to go to what we consider to be a legitimate clinic and a really great doctor who's very caring. And this is real. Surgery is real, man. I mean, you have to be with. Not everyone's going to make you happy. Not every. I can guarantee you that every doctor that we've ever talked about has unhappy patients. That's just the nature of cosmetic surgery. But at least you have a fighting chance.
Yeah, I'm going to tell you, it is surgery. I don't care. I watch these videos. Oh, it was this and that. No. You took a chunk out of my head, and then you bandaged me up and sent me on my way. I did feel it for a while. It wasn't like severely painful, but my body was definitely like, you went through surgery. You know,
that's the real deal, man. That's for real. This is even, everyone's like, oh, non-invasive FUE. FUE is invasive too.
I got to imagine it's the same thing pretty much. I mean, and it's
not,
an operation.
It's not the same. It's not the same, but it's still invasive.
Well, yeah, it's not the same, but you do feel it. Like FUE, I'll tell you, my very first experience with FUE on the scalp, like I had body hair experiments before I had scalp experiments, but it hurt bad. It hurt real bad. It hurt worse than any strip surgery I'd ever had. But at the same time, I think the doctor was just kind of rushing through it just because he wanted to. Yeah, I won't go into it, but it wasn't pleasant. But when I had FUE in not last summer but summer before last, was it 2019? That was really smooth. I will say that much. But when you have a strip surgery, let me ask you if this was your experience, Ray. Did it feel like you're wearing a helmet for a few weeks?
Oh, definitely, man. There's definitely a part of my skull that I really couldn't feel for a couple of weeks after that, the top part. And it's still just a touch numb. Like, I've been derma rolling and using Minoxidil, and when I derma roll on this certain spot on the vertex of my skull, I can't really feel it near as well.
The fact that it's still just a bit numb means you're in a good position, that your nerves are firing off quickly. They're growing back together, probably at a faster rate than a lot of people.
I definitely can feel the areas that were numb initially for the first week or two.
Yeah. No, I mean, that could last for a very long time.
Great. Yeah, the doctor was really great. I mean, I see all these videos about people going to these places and then they don't even know the doctor, or it's not even a doctor doing it. And these technicians that may or may not be trained well are the ones that are doing all the...
Well, that's what you were going to do. That's where you were headed, dude.
You're right. You're absolutely 100% correct. I was going to go to a guy who bought a machine and had to pay for it.
Yeah, that's exactly right.
And I'm so glad that I didn't. I look in the mirror now, and I don't fear that it's not going to work. I just wonder how good it's going to look.
Well, and that's the thing. You never know, and you could be disappointed, but you're probably not going to be disappointed. And don't hold me to that, but I mean, Aaron does really clean, solid work. And this guy's been around hair transplants his entire life.
Literally, since he was 5.
Oh, that's what he does. These guys take it seriously, man. They know it's real surgery. His dad trained him well. I've known his dad forever, for my entire career.
Yeah, I see a lot of videos, too, where these guys are like, oh, I went into the place, and it was like a spa, and they treated me so good. And, I went into the place, and it was not like a spa. It was like a doctor's office.
Yeah.
It was clean and nice, but there was nothing special. Everybody was nice to me, but nobody rubbed my feet. I didn't need that. What I did like was when I went in there, I saw
professional.
6 ladies. Right. I saw 6 ladies at the thing working on microscopes. They weren't talking. They weren't bullshitting. They weren't doing anything but making it work. They were quiet, and it was just bam, bam. That's what I paid for.
You're right. You're not walking into like with a waterfall and all kinds of bullshit. Yeah. You're going to a doctor's office.
Exactly.
Yeah.
And he was there. And he's looking in and he's saying, "Did you do there? Point that there. Put that there." And I just I feel bad for people who have went to some other place and can't contact the doctor who did it.
Yeah. Well,
I think that would be tough.
Like I'm dealing with something right now that's involving a chain clinic, and it has to do with the media and whatever. And I'm thinking to myself, God Almighty, man! If they give this, if they gave these people the opportunity to promote themselves through this media outlet, they're just putting people in harm's way, man. The media doesn't understand, the press doesn't understand, television doesn't understand. The people like yourself who didn't find us, sadly, and there's thousands of them every day who are having either their lives destroyed or they're having very mediocre work done. And they could have had a much better procedure.
There's a lot more access to help those people than there's ever been before. I mean, you're older, probably a little older than I am. I'm 53. But
how dare you? How do you know I'm older than you are? I'm just kidding. I'm almost 56.
Well, because of the
That's
amount
awesome.
of cynicism you're able to pour. Because of the amount of cynicism you're able to pour into a bowl full of sugar, I feel you got a couple years on.
There you go.
Well
there
done.
you go. This guy's been around. Yeah, well said.
Yeah.
Well, listen, man, we're gonna go. I gotta run and get some food.
I just wanted you guys to know that we're out here, we're listening. I'll check in and maybe send you a photo in 6 months. When the thing is all full grown in. I really appreciate what you guys are doing, and it's definitely it definitely helps people, and it definitely helped me. And I'm glad that you were there to help me make a decision. And hopefully, this conversation will help other people to take a moment before they make these rash emotional decisions and to have a professional, have at them.
And I appreciate that. And if anything goes wrong, just
Thank
call
you so
Joe.
much. My phone doesn't work.
Listen, dude, good luck. And I know you're gonna call back and you're gonna say, you know what, I had a great result. I don't know that, but I'm pretty sure.
I'm pretty sure too. And I thank you guys so much.
All right, good luck. Take care.
All right.
Thank you.
Take
Have
care.
a great.
Guys, I got to turn the phones off. I know that people are on hold, but it's late. Got to go. Got to eat. Oh, we had 80, and someone took off the like.
I know, and then put it into a dislike.
That is amazing. That's why I took that second call. All right, guys, let's make it 80 before we get off the air. The website's thebaldtruth.com. Joe's website is hairtransplantmentor.com. Anyone who's listening, watching us through GFQ or listening on everywhere GFQ is airing the broadcast, iTunes Radio, whatnot, go to youtube.com/hairtransplantmentor. Subscribe, ring the bell. You can watch us live on video, and you could be notified that we are doing the show live when we go on live on Fridays. Hair transplant. Oh my God. I almost said something fucked up. hairtransplantmentor.com, ihrs.org for the International Alliance of Hair Restoration Surgeons. Check out the American Hair Loss Association website, which has not been updated since the Civil War, but we're going to change that. But the information is still great. It's AmericanHairLoss.org, baldtruthtalk.com. That forum is being spammed like crazy. We're trying to work on that. But I got to tell you,
yeah, it's tough.
The traffic is just, no matter how much I tell people to stay off the forums, they're on the forums. So if you want to interact with each other, if you want to get some, see some great before and after images, just don't spend too much time there. Just don't drive yourself crazy. Check it out. It's baldtruthtalk.com. Anything else? Did I miss something?
Trying to grow my Instagram, so go hit me up, Joe Tillman Official on Instagram.
All right. You know what? Hit me up too. Don't hit me up, but follow me at Spencer Coburn. At Spencer Coburn. I have not been doing much on that, and I have some followers, and I do put out some content, but if it starts to pick up, we're going to put out some really unique content on both of ours. And that's a promise. Well, it'll be unique to me because it's all new to me doing this social media stuff.
Like these young kids are doing.
Like these kids are doing. Got to keep up with them.
Kids today.
That's a struggle for me, honestly, even doing YouTube, doing your stuff, doing, putting out the podcast, all that stuff, because,
It's a lot of work.
Well, I used to
and
go
then
on the
top
radio.
of that, we're supposed to understand what finna means.
Yeah, Jesus.
It's like, what?
This was my job. I wrote some books. I got into books. I do my organizations. I deal with the business aspect of everything, and we help people. I got on, it was on national radio. I sat in front of a mic. I didn't have to do anything of my own board or whatever it is. Do my show, and we were able to contact and be in contact with literally millions of people over my career. Now, what do you got to do? You got to constantly put out content. Otherwise, if we don't do that, people's lives are destroyed. That's the pressure I'm feeling.
That's what we're doing here. We're trying to keep your lives from being destroyed.
Cut.
That sound right?
Yeah.
Yeah.
Kind of.
Cut.
Yeah. Someone's going to use that and say, "Well, you know what? I went on.
They're making fun of people getting destroyed
because of Tillman, and he's making fun of people being destroyed."
Yes, exactly. So cut that clip. It'll be out there. Piete Bell, Joe is laughing. Well, I laugh. What's wrong with laughing? You got to have fun. Rob Hellner, what WTF is finna? It's FINNA. And someone sent me a message the other day saying it's a combination of two words, but neither word breaks down to finna. It's kind of like, I think it's fixing to or something. I don't know. I wasn't paying attention, but that's what it is.
Getting old, dude. That's all I'm going to tell you.
I'm telling you.
We gotta up your game, your hip game.
My hip game.
Your hipness.
I got the lights.
You gotta up your social hipness or whatever it's called. All right, guys. Until next time, be strong. God bless, and thank you so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave.